Hi, I'm Allison Strong. I'm a Broadway TV and film actress from here in the Garden State, and I'm inviting you to watch my friend Mabel Aragon on her show Kickin' It with Mabel, where she interviews a lot of cool guests, myself included. Tune in.
COVID-19 has left a permanent mark in our lives. It's a pandemic that left our country with over 18 million cases and more than 330,000 deaths nationwide so far. Joining us today to discuss one perspective of the coronavirus that's based on his collaboration with Dr. Adam Jarrett is Paul Rosengren, the author of a book entitled In the Time of COVID, One Hospital Struggles and Triumphs. Paul, welcome.
Thank you for having me. It's great to be here.
I've had the pleasure of knowing you as a writer for many years. So I have to say, I wasn't surprised when I learned that you wanted to delve into this particular project. Can you share with us the steps that led to this?
Yeah, there are really two ways that these kind of collaborations come together. Sometimes they're really well thought out and planned, and sometimes they just happen. And this was one of the latter cases. We're having a couple families over in our backyard for a social distance get together. A little bit into the first wave. It was probably at the beginning of June, and one of the guests was Adam Jarrett, who is the CMO, Chief Medical Officer at Holy Name Hospital. And people were just, pinging him with question after question after question about what's going on and what we know about COVID, what we don't know about COVID. And he was answering them so well, so cogently, and as well as in putting them in context. And I said to him off the cuff, "You should write a book, Adam. This is really good." And he said, "I'd like to write a book, but I need help writing." And I said, "Well, I could do that." And by the end of the evening, we were kind of toying with, well, is this something we really want to do? And so that Tuesday, that was the Sunday, he came over to my house and he spoke nonstop for about 4 or 5 hours with me just taking notes. And from that, I wrote the first chapter, which actually still is the first chapter. And I said, "This is the kind of book I'm looking to write. And what do you think?" And he liked it. And we decided to keep going. About 3 weeks later, we said, "Do we have enough material here?" And we thought we did. And so we decided to put out a book in about 6 months, which is pretty fast. And I think we did a good job of basically capturing his ability to tell a good story with sound medical information.
How did you determine what you would highlight in the book?
Well, it really was interesting because we're right in the middle of it. So some of that evolved while we were writing the book, because that was one of the challenges. Things were changing even as we were writing this. It was clear we had to talk about vaccines. It was clear we had to talk about treatments. But those are the two that had changed up until the day we published, because treatments have been evolving. So we did talk a lot about what worked and what didn't work for treatments, what were his concerns about vaccines and what were his hopes for vaccines. Um, and some of that still holds true, but some of it may be a little bit clearer now than even when we published. But I think probably one of the most interesting parts was something that he added at the very end, that Adam added, and we had a discussion about, which talks about what treatments he would want at what stages of COVID. And I think it's really helpful for anybody who has COVID or knows somebody who has, to kind of understand, well, at this stage, this makes sense. And at this stage, this does not make sense. And to kind of walk through it. So it's, I think it has really good practical advice for people who are facing this firsthand, as well as I've been told it's a fun, interesting read, because we did try to interject a fair amount of stories, of what he saw or what he experienced, or some of the heroes, and the heroes that you expect, the doctors doing great things and the nurses and et cetera, but also, the behind the scenes work that was done, the engineers who were basically rebuilding the hospital as it changed its complete focus over the time of that first wave. And to the people who were, what we call one guy, the radar, after MASH for Holy Name, who had to make sure he got the right equipment and got the PPE, and it wasn't easy, and he was very creative and very insightful. And so I think some of those stories really add to understanding it and feeling a little bit more like you understood what all the pieces that needed to come together for the hospital to treat the huge number of initial COVID patients in a time of uncertainty, as you said.
You shared that one of the things that he discussed with you is what would he want to have done if he was facing some of these struggles. What were some of the things that he shared?
So he talked about some of the treatments he would not use, such as the hydrochloroquine, and he said he doesn't see that there's been any studies that show that it has true value. He's a very strongly based, fact-based medicine. So he goes through all the treatments and what the positives are, the negatives, and which ones make sense early on, and which ones make sense later. We talked about the use of ventilators, and that initially the word out of Europe and Asia was that you wanted to get your patients onto ventilators as early as possible. And that clearly was found to be misinformation, not deliberate. It just was that didn't clearly wasn't the best care. And so he talked about wanting to be off the ventilator as late as possible. There's a time when it's needed, but you don't want to get on there too soon. And he also talks about being prepared for end of life decisions as a patient and as a family member, and how it's valuable not just for COVID but in life to have a better open conversation about that. And he talks a bit about the death of his own father and mother, and how that influences how he interacts with patients in those tough times.
Were there things, or because of the role that he had, was he collaborating with physicians from other hospitals? Was he gathering information about what was happening overseas? Because this is something that was happening globally and just so many people involved. I'm thinking someone in his role, I wonder if he got any sleep, starting with that.
Well, for the first couple months, he didn't get much. He was working nonstop, and it was months that he was working 7 days a week and 14 to 16-hour days. And during the off time, often getting calls, from people asking for advice and asking for his input into individual situations. Um, and one of the things I thought was really interesting was the level of cooperation between hospitals in northern New Jersey, which is a highly competitive medical market. There are lots of hospitals within a couple miles of each other. He said that the level of cooperation was the most he's ever seen, and he hopes that that's one of the things that will continue after COVID, because it really helped the care. And he also talked about the flow of information was sometimes community sourced. You got a call from a doctor in New York City who talked about blood clotting and saying, we're seeing this. Are you seeing this? And he brought it up on a call with other doctors, and quickly they determined that, yeah, blood clotting was a problem. And so every patient who came in was put on anti-blood clotting medication. And that was, in a normal time, you would wait for something to be reviewed and be in a peer journal, and it might be months or even more than a year before some of that information gets back to you. But here, the people were helping to spread the word and making sure that the level of care was just getting better and better as people were learning from each new patient.
As you were gathering information for the book and speaking to him, were there findings that surprised you?
Were there findings that surprised me? Yeah, well, to be honest, I was somewhat of a blank slate, so I was learning a lot. I was kind of surprised at the level of research that was going on at Holy Name, which is a really good regional hospital. It's independent. It's owned, by a Sisters of Peace, a religious organization, and I was surprised at the level of research that they were doing and studies they were doing there. Some of which has been very influential, and has been very successful. Others that weren't. And so there's a whole chapter on the excitement of finally getting a treatment they thought would work and then it didn't, and then some of the others that were more successful. Um, the other piece that I found interesting was that Holy Name Hospital was actually founded because of the Spanish flu pandemic. So there were a couple doctors and nurses who went to the Sisters of Peace and said, we don't think we're ready for the next pandemic, and it could happen anytime. This was a couple of years after the Spanish flu. And so they founded this hospital exactly for this pandemic, but it was, even though it didn't come for 100 years. So it's interesting how laying the groundwork for something may not pay off right away, but it pays off way down the line. And then this was a case where it did.
Because you had access to Dr. Jared and the information that you were gathering, did you find that you were taking certain precautions that other people may not have because they didn't have access to this information?
Well, interestingly, we're a little bit ahead of the curve. My son lived in New York, and he has asthma, so he wanted to get out of the city, move home, and so we did talk to Adam about, well, what do we need to do? And he was like, well, Paul, this is pretty bad. I'm out there telling people, but I don't think people are getting it yet. So the next day, my son and I went out and we went shopping at a food store with 2 carts, and we loaded it up. We bought a new freezer. We completely filled it up. I called Adam and I said, Adam, this is what we did. And he said, why did you both go? He said, this is all about reducing risks, Paul. So you could have reduced risks more by keeping your son, who's most at risk, at home, and you do the shopping. And now you have 2 people going out, twice as much chance for exposure. So it made me rethink, he said, you're always going to have some risk. It's all about lowering your risk and knowing what your risk tolerance is. That story is actually in the book, but with a different name. I didn't want to use my name on that, but it's in there because you know what? Part of this is mistakes were made. I made a mistake there. Adam talked about a mistake that he made where early in this crisis, before we even knew it was in New Jersey, he called whole staff together and said, anybody who wants to learn about COVID, come. We've been studying it. We're going to have experts from our hospital talk about it. And they expected, maybe 50 people, 75. 500 people showed up. And, they talked through what people were seeing in Europe, what the symptoms were and all this. And lo and behold, the next day, they identified 6 cases of COVID come in the door. That doesn't mean that before then they had no COVID cases. It meant that the heightened awareness of the staff allowed them to realize this isn't pneumonia. This isn't a regular pulmonary disease. And interestingly, because they announced the next day, we have 6 patients with COVID, that's where they got all this press attention that, oh my gosh, this is the epicenter of COVID. Every other hospital probably had the same patients because it was much more widespread in the community than people thought. But they were on top of it, they were ahead of it, and they were beginning to catch it.
I'm assuming that you're still in touch with him, and now, as you said earlier, things continue to evolve. In the last 2 weeks, we've heard of the Moderna and the Pfizer vaccines. I'm curious, what's your take, and what has his take been about these vaccinations?
Well, he's taking it and encourages people to take it. He does, and the book goes through, be careful of silver bullets. Hopefully this vaccine will be a silver bullet, but there are concerns about vaccines. He thinks the benefits of vaccines outweigh the risk, but you do need to be aware there is a risk and there are challenges. Getting this many vaccines to this many people, especially if they give them twice, and under the extreme circumstances they have, with the extreme cold they have to be transported in, is a logistical challenge. And people can't just expect that it's going to happen, boom, without problems. There will be some people who have negative reactions. But the question is all, again, he said, it's about weighing risks and looking at the facts. How many people have had reactions? What are the type of people who've had reactions? What are the benefits that we're getting? He feels it would be very unfortunate if not enough people took the vaccine to create the herd immunity. He said it is basically selfish for the individual because it is definitely better for society if we can get the vaccine out and stop the spread of this. I mean, I talked with him just the other day, and he said he still thinks, even with the vaccine beginning to hit, that the United States is going to have several 100,000 more deaths before this is under control. That's a lot, and it just makes me. I'm still confused about how people can say we've had 300,000, we're going to have 500,000 deaths in the United States, and not be more freaked out about this. We're having a similar amount of people die every day as equal to 9/11. Look what we did after 9/11. Um, you know, a lot. The country really responded and really gathered together and made changes. And I think we should be doing a lot more. And we kind of talk about that in the book of what we should be doing. Obviously, individuals, but also that there's a real obligation for to have better information disseminated. And who should be doing that? He thinks it was a mistake to have a politician be the main source of information. Also, the same thing when the president or vice president gave out that information. In a public health crisis, a public health expert should be giving that information. And if the politicians want to talk about policy or politics, great. But the basic healthcare needs to be separate from the politics. And he said that was probably one of the number one errors he saw in dealing with this pandemic, was that it became too political. And that has led to bad behaviors and bad decisions.
One of the subject matters that you talk about in the book is the simulation unit. Can you share with us more about that?
Yeah, so a group of people from Holy Name went on a tour of hospitals in Israel, and one of the things that impressed them was a simulation unit that they found at one of the locations, and they have instituted a state-of-the-art simulation unit in Holy Name, which they've used to test out a lot of new ideas. For example, they have something called an isopod, where they're able to isolate an individual who before they know whether they have COVID or not, so that they make sure that no one else is exposed. And they tested that using dummies and fake smoke in the simulation lab, and it was able to show that it was extremely effective at isolating anything that might be exhaled by a patient. And they've used that for many other things as well. They use it to help caring staff understand what it's like to have Alzheimer's. So they have a whole training where you go in the simulation lab and you wear mittens and they have strobe lights on and the music is loud and you have to perform tasks and it's very difficult. So it's just to help make make the staff more aware of the challenges that Alzheimer patients go through. So it's a simulation that's used for many, many different things. But it's one of the things that really impressed me at Holy Name.
In addition to the simulation unit, there are a lot of stories that you talk about in the book. Can you share with us, another story that you found was really interesting, something that you didn't expect, or?
So obviously, we talk about some of the sad stories, people who passed away, or people who suffered during COVID. But we also talk about some of the triumphs. And one of the nice things is every time anybody left, they played a inspirational song, and those songs varied. There was a nurse at Holy Name who was on The Voice. She was a finalist for The Voice. I can't remember her name. I apologize. So they played some of her music. They played music from Rudy, which is an inspirational movie. One time they played a song from Wicked because the person was the set designer for Wicked who was coming out. But one of the stories that most impressed me was there was a police officer from Union City who had performed CPR on his mother, who turns out to have COVID, and she passed away. And then he got COVID, and it was a bad case, and he was on a ventilator for some time. But he survived, and he insisted on walking out of the hospital. And when he walked out of the hospital, all of the police force from Union City was there to greet him and his family and friends and all the hospital staff. So as he walked out, it was this just tremendous amount of support. And after all of them had walked away, one police officer, the police chief, a woman, walked back and said heartfeltly how thankful they were that they'd already lost one police officer to COVID. They were convinced they were going to lose another, and how grateful they were. And it was a really moving moment.
So what's great about this book is, as you shared, not only is it the medical aspect that we're informing individuals about, but just these stories, as you said, some of them are so tragic, and then some of them are just so heartwarming and provide at least some light at the end of the tunnel.
There were a lot of stories of people doing really interesting things, as a result of the necessity and the need for innovation. So, I mean, if you walked through, through the neighborhood or went by the hospital during the height of COVID, you would see it was almost like spaghetti flowing down the from the roof, because each room was individually ventilated to the roof, and was so that they could suck the air out and move it out. Every room was negative pressurized. We talked a lot about why that was so important and was so valuable. But it took a lot of work to do that, and it made a huge impact on the quality of care that was given.
When you talked about vaccinations, when you got to that portion, what were the thoughts? What were the findings about having people vaccinated that are older individuals? Because I've been hearing about the manner in which people are getting vaccinated. Obviously, our frontline workers. Now it's going to these facilities where we have our elder population. So for those individuals, so our older population, are they at any risk of it harming them in any way?
So you really want to target the early vaccination to those that are going to have the biggest impact, the biggest benefits. So clearly, in the early stages of this pandemic, the number of people who died who were over 70 or in nursing home facilities and specifically was much higher than the general population, significantly higher. That numbers have come down in part because of the extreme measures they've taken. My mother has Alzheimer's and is in a nursing home, and I have not seen her since March. That's tough, but it's also her nursing home has had very few cases and no deaths. Um, it's in North Carolina, so they had a little bit of warning to put in some tough restrictions on visitation. In New Jersey, as we saw, this just basically ran right through certain nursing homes with scores of people who died. So I would say yes, nursing home facilities should be near the top of the list. They are the most vulnerable. It is also a possible vector for spreading amongst the healthcare community, and I think that makes sense. As in any population, there are risks. As in anything with an elderly population, the risks may even be higher. But the benefits are so much higher amongst the community that it's one of those things where you have to weigh benefits and risks, and the benefits clearly win out. So I think, yes, it makes a whole lot of sense. And I'm sure Dr. Jared would agree on that one.
Moving forward, what types of research is being done for someone in his position? How does he move forward? Is it okay? We know the vaccinations, we know that's in place, but what other steps are we going to take? Because this is far from over. I mean, I love the enthusiasm that people have about the vaccination, but in the back of my mind, I'm thinking, I feel like it's some hope. It certainly gave me some hope. I can't say that it relieved me of my concerns. So I'm curious, was that something that you touched on in the book? And what are some of the thoughts?
So we talk a lot about treatments and what's working and what's under study, and a lot of the studies have a tremendous amount of potential. They still need to, studies do a couple things. You often hear about whether they work or not, but the bigger important thing for many studies is when they work and on what populations they work. So some of these treatments make a big difference on whether you give them early in the course of a disease or later in a course of disease. They may work better for an older population than a younger population. And it takes time to do those studies. Um, some of those studies are coming out, and it is a reason why we're having better care now in hospitals. Um, it's also really important, and again, laying the groundwork for the future for the next pandemic. I mean, we don't know what's going to happen to this virus. We know it's mutating. We know it's gotten more um, contagious. The mutations and viruses are very quick. They go through many generations very quickly. So there's a really good chance that there'll be more mutations that we need to deal with. And so all the research we're doing now will help us prepare. The next pandemic may not be for another 100 years, let's hope. Could be 6 years. So we just need to be prepared. There was a great quote by a record reporter who basically said, one of the things that we did wrong was we weren't able to imagine how bad this could get and how quickly. And I think we need to keep that in mind as we're imagining what's next. I think we often treat things based on the last past experience. So Spanish flu was 100 years ago. We get through this, we have 100 years of cleaner sailing. We don't know that. So we just need to be prepared and continue to be making sure that we do the basic research that allows us to get better at making vaccines, to get better at making treatments, and we need to do long-term follow-up studies because even if we don't have a problem for years, what we learned with the swine flu vaccinations, when the swine flu turned out not to be a big problem, but we did a lot of vaccinating, vaccinate a lot of people, that there was long-term impact on a small portion of the population. So we need to be studying whether that's going to happen here. We just don't know yet.
Because this is something that's ongoing, and let's be perfectly honest, I see this through. I don't see myself removing a mask outdoors through end of 2021, and that's just me being extremely cautious. Do you see yourself maybe doing a part 2 to this book? Because there's still so much that's left unknown.
Well, it's interesting because, like I said, we were changing this book up until the day it was published. And I think we're probably more likely to put an epilogue. I think this is a historical book, and people need to understand it's constrained by the time frame. COVID allowed this book to be written, in part because both Adam and I had full-time jobs, and I don't think we would have written this without the restrictions on our own lives that COVID gave us. So, I mean, we didn't travel. I had weekends free. I had evenings free. So I don't know that we'll have time for another book, but and I'm hoping there's not enough material for another book. So let's knock on wood that the worst is behind us. But I'd love to write another book with Adam. He's a great storyteller and a good collaborator. We worked well together. What was interesting is we sent the first 9 chapters to a bunch of friends, and they came back split. Half of them said, love the stories. Usually they pick a chapter like chapter 1. They said, I love the stories. But there was too much medical information. And then the next friend would write, the medical information was so valuable, I loved it, but the stories kept getting in the way. So we really had to walk a fine line of making it a fun, interesting read and packing in a lot of information. And the good news is, at least from the reviews so far, is that we did a pretty good job of that, and that people are finding it an easy read that gives them a lot of information. And I think that's really what our goal was. So I'm pleased with that.
Well, thank you so much for taking some time to talk to us. And it's such clearly it's a relevant, timely topic, but so many people have a lot of misinformation and just a lack of access to information. So be able to find it in a book and to hear it from an expert, I think it makes a world of difference. And for generations to come, it'll give them some insight. Like you said, hopefully, it's very likely in about 100 years, hopefully in about 100 years. Although I'd like to say I hope this never happens again. I hope that we never experiencing anything remotely similar to what's occurring. But if it does, it provides some insight. And this is the book that I'm going to say will keep on giving.
Well, thank you.
Yeah, I mean,
I'm
definitely.
glad you found it useful.
Absolutely. No, thank you so much. I'm so glad that you had that opportunity to collaborate with Dr. Jared, and for sharing your time with everyone else and provide a resource that's going to be so useful.
Thank you. It was great talking with you.